My name is Dr. Jonathan Arend. I'm the New York Legislative Director for the National Physicians Alliance, which represents over 20,000 physicians nationwide. And in addition to the majority of America's physicians, including organizations that represent over 500,000 physicians, the National Physicians Alliance is in strong support of a public health insurance option and the reform legislation that's being proposed. I personally am in support of a public health insurance option because it's the best for my patients. It would allow me to provide the best possible care that I can for my patients. I saw a patient last week she's a single mother. She has a life-threatening bleeding disorder, and she just told me the other day that her employer can't afford to provide employees health insurance coverage anymore, and he's going to drop their health insurance coverage. And she's getting ongoing treatment for her medical condition, and so she asked her employer, what am I supposed to do? Where am I going to go from here? And his advice to her was basically maybe cut down your hours so that you can apply for Medicaid. So this is what I see every day as a physician. People losing their health insurance. They don't have a secure source of health care. In addition to folks that have stable health insurance that just can't afford their payments anymore. Private health insurance CEOs are making over some $30 million a year, and I have 84-year-old grandmothers with chronic medical conditions like diabetes that can't afford their medications. So public health insurance option would do a number of things. It would allow my patients to actually enjoy affordable health care, stable health care. They know that no matter what, they're not going to end up like my patient with this bleeding disorder, that they're always going to have health care no matter what. And it would also provide an opportunity to really improve the quality of health care. Unlike most people or many people's assumptions in the United States, we actually have quite poor quality of care on a number of important indicators. For example, coordinating care, supporting care for chronic diseases like diabetes and high blood pressure. We actually don't do such a great job at this. And a public health insurance option would, as a primary care physician, first of all, it would actually pay me for doing those sorts of things that actually keep people healthy, keep people out of trouble, coordinating care with other physicians, spending time with patients, talking to them about how to take care of their diabetes, or following up with them on the phone about checking their the blood sugars at home or the blood pressure. All these sorts of things, they take a lot of time and energy, and these are things that are not supported by private health insurance right now, and they would be by a public health insurance plan. So giving patients choice, security, and an opportunity for higher quality care. These are the reasons that I support a public health insurance option.